I'm about to have my vaccine. I'm practicing what I preach. When offered, please take the vaccine. It will save your life.
Sounds great.
Thank you.
Just relax your arm. Beautiful.
Thank you.
You okay?
Thank you very much.
Very welcome.
Thank you.
You're welcome. So I'm going to pop that here for you.
Okay, John.
I wanted to say, you will see from the title of the meeting, and I'll thank both Grace and Sue for putting the schedule for this meeting together and arranging this meeting. And I know all of them, including and Omar as well, who put together getting the leaflets out, getting the publicity for this out as well. It's been really helpful to spread that message. I think it's also important to say this is a public meeting. This is not a Labour Party meeting. And the reason was we've had earlier Labour Party events around the disproportionate impact of COVID over the course of the last year, but this is about the importance of ensuring people to take up the vaccination. And the story as to why Grace and Sue will talk about that shortly, but I just wanted to stress that before anybody starts talking party political matters. So as we know, the impact of COVID-19 has had a disproportionate impact on ethnic minority communities, and that's been evidenced, and some of the speakers may want to talk about that when they do come up to talk about it. And the early meetings have explored that, and I think, yeah, Grace is on the agenda to explain the journey of what we got to tonight in terms of this meeting. But tonight is about overcoming vaccination hesitancy, the refusals and the skepticism that exists out there, and some data I think will be shared, perhaps I think by Julian as well, where we are in terms of Ealing take up and any lower levels of take up among some communities. But tonight is about encouraging what we can do to dispel some of those myths about the vaccination and how we can address some of the hesitancy that people may have about taking it up.
Hi everyone, I'm Susa Kumaran. I happen to be the disability officer in Ealing Central and Acton CLP, and I'm also a psychiatrist by trade. I got interested in this issue of vaccination hesitancy when I realized that there were a lot of people where I work in mental health, particularly of minority ethnic origins, who were expressing doubts and anxieties about the vaccine, even though they worked in healthcare. So that got me kind of interested in the topic and to read more and find out a bit more about it and to get involved in this kind of campaign. Okay, so first of all, one of the questions people ask is, how do we get a vaccine this quickly? Normally, basically the point, this was by one of the leads of epidemiology from the World Health Organization, who was actually an Indian lady, talking about how the trials were done so quickly. And they said they had them going in multiple places. And instead of doing one set of trialing on one set of people and then moving to another set of people, they did them all concurrently, shared data across different countries to make sure that they had, they included a very wide range of people. And while they were doing the trials, they were already organizing the funding for the next stage and organizing the paperwork to get approval from the various regulatory agencies and so on. So they were doing all of that concurrently instead of one step at a time. So that's how we reduced what would have been a 4 or 5 year process into one. So in this country, we've got the Medicines and Healthcare Products Regulatory Agency, the MHRA, who are in charge of checking on the safety and efficacy of anything before it gets unleashed on us, the public. So they're scientists and doctors and all kinds of experts, as well as lay members who have this job to study in real detail all the evidence and data on any kind of risk. So it's a really thorough job they do before they approve anything. And as we know, they approved Pfizer in December, Oxford, AstraZeneca in January, and then Moderna a little bit later. And now we've got Johnson & Johnson coming up as well. So what do we know so far about how safe and efficient, efficacious these vaccines are? So these are the initial trials for the Oxford AstraZeneca one. And they had trials running concurrently here in Brazil, in South Africa, and later Kenya. And they started with working age adults, and then they expanded it to include older people and people with underlying conditions, and then other high-risk groups like healthcare workers. And what was good was that the results were consistent across these different countries, who of course are very different demographically and culturally and economically. And out of 11,000 participants, there were only 3 confirmed adverse events that were definitely linked to the vaccination. All 3 of whom recovered fully. So that's pretty good data for safety. Similarly, with the Pfizer vaccine trials, which were done in America, again, they had roughly about 11 reactions per million doses, of which was 21 people altogether. And there was no link to that they could find to any of the particular vaccines or which clinic it was given at or anything like that. These are all people with a history of serious allergies and anaphylactic reactions, including someone who had a reaction to rabies vaccine and somebody else to flu vaccine. And 20 out of the 21 recovered fully. The 21st person we don't know about because there's no information, but there haven't been any deaths reported. So we're assuming that 21st person is alive and well. What we know from our data so far, since we've been rolling out the vaccines, when they looked at the data January, February this year, after about 1/3 of all our over 80s population had been vaccinated, we found that there was a reduction in death rates and hospital admissions and overall infection rates. So was this just due to lockdown? Because you'd expect lockdown to bring all these things down. But what was striking was that there was a bigger drop in the people who'd been vaccinated, so the over 80s age group, compared to the rest of us. And in Scotland, they found the biggest drop in care home residents, which was the first group that they vaccinated. So the fact that there was a bigger drop in those groups compared to the rest of the population suggests that it's the vaccination that's responsible and not just lockdown. And we also know, obviously we've only been doing this for a couple of months, so things are still emerging. But from what we've seen so far, it does seem to reduce the severity of the illness you get. So even if you catch it, you're much less likely to need to go to hospital. And we know that we need about 85 to 90% of the population vaccinated to get real herd immunity. In other words, where the bug then doesn't spread from person to person because each person is immune. So obviously the MHRA are continuing to monitor the situation, gathering data, any adverse effects, whether or not it's due to the vaccine, have to be reported. And that's, members of the public can do it, professionals can do it. And they share data with other countries. So our European partners, with America, in other regulatory agencies. So we know across the world what's going on. Now, looking at vaccination acceptance around the world, it does vary. So these are sort of surveys they did before we had all the vaccines approved. And the highest sort of rates of people being prepared to accept vaccines, over 90%, was in these countries: Ecuador, Malaysia, Indonesia, China. And the lowest acceptance rates are 25 to 50%. So these are people saying they would accept a vaccine when it was available. And the lowest rates were in the USA, Kuwait, Poland, and France. So not obviously similar countries. And what the surveys also noticed was that the rates went up and down over time as people felt more confident or less confident about the illness, and as the situation in their countries changed. People with families tended to be more accepting of having the vaccine than people without. So what influences people's attitudes to vaccines? Obviously, first and foremost, availability of a vaccine and having access to it. I mean, we're lucky in this country, we've got an NHS. Imagine places where you've got to pay for the stuff. There's a perceived health risk, so people are worried about, the risk of side effects and reactions. Another thing that influences attitudes is how much information people have on the benefits and risks and access. And if they've had previous experience with other vaccines and diseases, then that might have been negative. And obviously things like age and education level and so on can influence someone's attitude. And the previous experience of discrimination, which is what we're all here about today. So for example, there are people in the so-called developing world who are very suspicious of Western governments and their attitudes. For example, the operation to trap Osama bin Laden was by the CIA involved a sort of pseudo vaccination operation, which is how they got access to the place where they thought he was. They pretended to be sort of children's vaccinators. And obviously they got their man, but he then created a lot of suspicion in the community about vaccination and was criticized by the World Health Organization and UNICEF because they said that kind of fakery undermines actual medical programs. Here we've had several studies. I think this was one of the first big ones in 2020 by Bell et al. That ethnic minority communities are 3 times more likely to want to refuse vaccines or to say they might refuse. They looked into why people felt this way. So the people said they would accept it, said they wanted to protect themselves and others, particularly those who worked in healthcare or health or care. There were people, particularly the elderly, who wanted to return to normal life and be able to see their relatives, etc. There were people who said they trusted the NHS. And I think the level of trust in the health service is probably higher here than in some countries. And of course, there were people who said they wanted to protect their children. And then they looked at why people were refusing. And there were people who thought there wasn't enough evidence, everything had been too rushed, and they were worried about safety and effectiveness. They thought they're at low risk, they've already had COVID, so they were immune and they didn't need a vaccine. And of course, there were people worried about what was in the vaccine, and they felt they couldn't trust professionals and they couldn't trust the information they had, and they didn't trust the government. Now, we know worldwide there has been a lot of discrimination in different countries against different minority groups. So for example, Christian communities in Korea, Muslim communities in India, Shia communities in Pakistan, and where people are blamed for the spread of the disease or said identified as having brought the disease into the community or the country. And this is sort of pre-existing discrimination against these people, which has now gotten worse. So they were blamed and sanctioned for spreading the disease. And that hasn't been a good thing. So recently we've had the Indian Prime Minister, for example, actually making positive statements about unity and that all communities need to come together. But that kind of messaging isn't out there in a widespread way yet. So I think this kind of discrimination is still carrying on. So these are some of the common myths about vaccines, which we're going to talk about, other people are going to address today. Firstly, that it's a mild disease and it only really affects older people. So if you're young, you don't need to worry. We know that's not true. Second myth is that masks and social distancing are no good. We know they don't completely prevent the spread of disease, but they do help a lot. Or about the vaccine itself, that it alters your genetics, or that it contains a microchip and you can be tracked. None of that is true. What we have learned is that a lot of countries, including ourselves, failed to control the pandemic in the early stages by having enough isolation and contact tracing. So we ended up having to lock down, which of course is not always possible to enforce, and a lot of people break lockdown rules. And so the disease then spreads and becomes a major problem with lots of deaths. And we've known this from previous pandemics, what we need to do, but we've not done it. We learn from history that we never learn from history, as George Bernard Shaw said. On the positive side, we have come together in the scientific sense to collaborate and share data. And we've now got vaccines. Now, is that a miracle? And in the UK, we know that one of the ways in which people have been trying to combat hesitancy is the religious leaders taking a strong stance on it and promoting and setting examples themselves. We've had the Mosque and Imams National Advisory Board, we've had the Board of Deputies British Jews, Church of England, the Vatican, the Catholic Church. So all the various religions, I think, have gotten involved, or leaders have gotten involved in messaging to their communities. And I know local, for example, Gurdwaras in this area have been involved. So these are ways of getting people to overcome their hesitancy. One of the worries that's come up recently, of course, is what about the new variants of COVID? It's not absolutely clear yet if the current vaccines do work or if they're any less effective. So far as we can tell, it's not a major difference, probably a little bit less effective. But the vaccine makers are saying it's easy to modify the vaccine for each particular variant as necessary, like we do with the flu vaccine every year. Each vaccine every year is slightly different from the previous years, depending on what sort of virus is out there.
Sue, is it possible to wind up soon? Sorry.
Oh, yeah.
Thank you. Sorry, Sue.
I just wanted to finish on this point that we need to get the whole world vaccinated. So far, we've got 10 countries, developed countries, that have administered 75% of all the vaccine doses, and 130 countries who have not administered a single dose. And the longer this thing is out there, the higher the risk of mutations and spread, and even more people dying. We know that UK included, but America, other countries, we've come together with to do the COVAX program, which is putting money to developed countries to enable them to buy vaccines. But vaccines aren't buying with money isn't enough, because what we need is more manufacturing capacity, and we need capacity and technology in the developing world. At the moment, a lot of the production is in our countries, and we need to get the stuff out there. And we also need to keep on with producing PPE and testing and medicines and oxygen. So all of that needs to be more fairly distributed in the other countries as well as in us. So that's a big job ahead of us that we need to get on with. I will mention this. I think we'll come back to this if there's time. Okay, that's me done.
Thank you, Sue, for that.
Going to show PowerPoint, because on that PowerPoint today on Sky News there was a very, very relevant interview with a Sir Jeff Palmer.
And women. The latest data from the Office for National Statistics says that 44% of Black or Black British adults reported vaccine hesitancy, the highest of all ethnic groups. I'm joined by Professor Sir Jeff Palmer from the School of Life Sciences at Heriot-Watt University. Professor, thank you very much indeed for being with us. Why do you think we are seeing these rates of vaccine hesitancy in some groups?
I think the reason for this is because at the beginning, we did not have Black expertise standing beside the Prime Minister. And I think that if we have a diverse society, then in fact, we must have, a diverse representation. And,
so it's about the way in which this is communicated.
Yes, the fact is that we have Black expertise on COVID, and therefore somebody from the Black community would understand the fears that Black people have about this vaccine. For example, the sort of the discussions initially about the whether the vaccine was working or not, and therefore they would see this as something which, in fact, is not rigorous and it is not safe, and thus they would not take it.
Do you think the fact that we were the first to approve the Pfizer-BioNTech vaccine and roll it out in this country, which has been great in terms of the speed of the rollout, but has that perhaps led to some concerns?
Well, yes, I think that in my country, say Jamaica, if you're going to be given a vaccine, you don't hear anything about the ifs and buts of its safety, and therefore those kinds of things. If we had a Black expert in medicine standing beside the Prime Minister saying the vaccine is safe, the discussion is about. It's scientific, but we've sorted that out. And take the vaccine because it is all the information you're getting is misinformation. People would take it straight away rather than 6 months later.
I mean, that message is being delivered, isn't it, by the government? But what you seem to be saying is it's being delivered by the wrong voices.
It is being delivered by the wrong voices. The Prime Minister can be there. It's just that we are a diverse society and we need diverse management in order to be seen to be fair and efficient.
What about in younger people, young women and young men? We heard from Nadeem Zahawi that the concerns about fertility among those groups proving to be quite potent. And the scientists have all come out and said that there's no justification, there's no evidence to suggest there's any impact on fertility, but those concerns are still there.
Yes, again, what I was saying is that we have a complex society, which is, we've got gender and we've got race, etc. The point is, for the same gender issue and about fertility, had we have people from the, women and BME people standing there actually clarifying the situation at the beginning. If you start to try and clarify it after people have doubts and fears, it's harder to do.
What about the campaigns that we have seen from celebrities, for example, trying to encourage people to have the vaccine? Do they have an impact?
I don't think when something is about health and something is about people's fears about health, this is a specialist subject, and bringing in celebrities is almost the general public is wiser than that, and they just see it as completely unacceptable.
What is the most effective way then now, as well as the communication? What about the accessibility of the vaccine, where the vaccine is being rolled out now? More vaccination centres in churches, in mosques, in temples, for example. Does that help negate some of the fear?
I think it probably does. But one thing which has helped to negate the fears is, for example, people whom they, have some respect and regard for. If these people are seen taking the vaccine, I was asked locally to take the vaccine, and Scottish, on the television, and they filmed it and put it out. And various people I know, as far as Jamaica, that video was sent, and it has had some influence. So somehow we have to have the right representation when it comes to health, or people will be left in doubt and will almost, as what I said myself, I don't want to harm anybody that I took the vaccine.
Okay, Professor, suggest.
Thank you. That was a kind of like segue for me to actually say that I feel representation is a factor. When we talk about vaccine hesitancy, there is a tendency to kind of interlink it with anti-vaxxers. And I think we need to have an understanding of if there is a difference, what the difference is. One seems to imply, for example, I have members of my family, I know people who come around now, but they were hesitant because they were concerned for some of the points that Sue raised earlier, to do with the fact that maybe they had the flu vaccine before and it reacted very badly on them. This point about it being developed too quickly, the fact that also in the trials, not many volunteers, if any, have come from Black and other minority backgrounds, especially Black, African descended backgrounds. All these feed into concerns. And one major point which was borne out in that video, which I feel is something we need to listen to, is the whole idea of representation. So it's also about the fact that trust is at a low ebb against the background of George Floyd, against the background of Black Lives Matter, the research that's come out, whether it's PHE England or the government or the Dorian Lawrence inquiry, the outcomes are the same. Black people, people of ancient heritage, some groups, Filipinos, we are disproportionately dying. We haven't had enough evidence since last November, and now we're having hesitancy. So the conversations I'm hearing is that people do not trust, and I've heard it, there may be even people in this room who've shared this view, but it's something that we really do need to take on board. Have a look at this. Now, this was quite an interesting piece of data, and this was taken last year, I believe, by Sage. Look at the figures there. Maybe this is known already, but just for us to recap, the highest group of people who were dying, who probably still are dying because we haven't got current data, Black British, 71%, as compared to other counterparts. And then you have Asian British, Pakistani, Bangladeshi, 42.3%. Now you can see the figures, and isn't it interesting that correlating with those figures, we have Black and Black British predominantly also hesitant towards the vaccine, and within the Asian communities, predominantly Pakistani and Bangladeshi are hesitant. So where you've had the large number of deaths, is it surprising? I'm not saying it's right, but we have to have some kind of understanding.
Community voice and organising these series of events, I think is really, really important. I mean, I've been to quite a few events over the last 6-7 weeks. I've been in events in Brent, in Harrow, in Hackney, and also there's been quite a few events organised by a whole range of Black and Asian health professionals. And it's interesting, I know Jeff Palmer very well actually, and the point he made was really important. You know, there's a whole range of Black and Asian minority ethnic scientists, immunologists, as well as GPs, doctors, or nurses. And when you look at the way this has been presented to us, it gives the impression that we don't exist or we're muted. And it's from the time that we had the pandemic almost a year ago, where, as we all knew, that a lot of majority of frontline staff in the NHS who died of COVID were from the Black and Asian communities. And despite the fact that Kevin Fenton, who I know quite well, was commissioned to do a report, and that report got shelved, and it required BBC to leak the report. And even today, that report is still not in the public domain, ironically. So, you know, and so the question that you framed today's event and the other events, you use the word hesitancy. Can I make a plea? Stop using the word hesitancy. And I'll tell you why. It implies that for those people who are unsure of taking the vaccine, it's their fault. It's the way that the government have used this language to say, we've made the vaccine available. If you're not taking the vaccine, it's all your fault. No different to how you died in the first place. I mean, it's as black, it's as cold as that. And we have to stop using the word hesitancy, because there are genuine reasons why people are not considering or not, or less reluctant in different communities in taking the vaccine. And I think Sue's PowerPoint slide gave a whole variety of reasons why people don't want to do it, or they're in two minds about it. Also, the bit that we haven't talked about is history, which is one of my passions. There's a historical perspective in this, and this is important. And sometimes the media plays this down. They think, "Oh, that happened a long time ago." What happened in Africa or Caribbean or in India or Far East has got nothing to do with what's happened here in the UK. But we live in a global world. We've come from different parts of colonies and the Commonwealth to come here to make Britain great. So that history is part of that legacy, including the Meghan and the royal family. But I'm not going to go there tonight, guys. Well, I might do. No, I won't. I'll try not to get carried away in there. So, you know, we have to look at the history of enslavement, that particularly Africans were experimented on during that time period. And after slavery, it was still used. I mean, the classic example case study everyone talks about was still relevant, and it's only in the last 40 years that this stopped, was the Tuskegee syphilis experiment, which started in the early 30s, lasted 40 years, where the public health department in Tuskegee in Alabama basically didn't experiment on African American men. That's misleading. Everyone thought they were experimental or taking drugs. All what happened was that these, in the Great Depression, you had a lot of people who had no jobs. Many of them were illiterate because of the whole Jim Crow racist system. People weren't allowed to get proper education. And they were offered by public health officials a few dollars, free lunch, and if they died, their contributions to their funeral costs would be provided for their families. And all these doctors did over a 40-year period was just to observe their deterioration of their bodies for some men who had syphilis and some men who didn't have syphilis. That's all it did. And this lasted for 40 years, and it was a journalist, and that's why independent journalism is really important. A young journalist discovered this, and this was exposed, became a national story. Some of them got compensation, and it changed the way how medicine and the role of public health was used in America, to be quite honest. I remember working in the NHS nearly 20 years ago, working for Brenton Health Authority, and working closely with various NHS organisations in West London. And I remember that during that time, during the Bill Clinton days, if you can remember those Bill Clinton days, there was a delegation of, I can remember it was so powerful. It was in the Hilton Hotel, basically going to Shepherd's Bush, and there was a whole delegation of African American and Hispanic senior health professionals. Our minds were blown away, because bearing in mind that we have been involved in the NHS from 1948, and it's still a kind of indictment of the society that, you know, we would expect by now to be at least 3 to 4 dozen BME chief execs running NHS organisations, medical directors, all senior roles, because we've been there from the very beginning of the NHS. You have to literally scratch your head to find a handful of BME professionals at, you know, running NHS organisations. Yeah, I'm not talking about non-exec directors, which I've been. I'm talking about at exec level. It's outrageous that that's been the case, and that's why Jeff Palmer talked about his points about representation. So I can remember the delegation of these African American, Hispanic people came to Britain, met Frank Dobson when he was the Secretary of State, and they signed a concordant about sharing best practice and learning between America and Britain around a whole range of healthcare interventions, policy initiatives. That didn't quite work out in the end, to be quite honest. But the people that were there, I was so impressed by these men and women. And so it's kind of standard. If you watch the news in America during the height of the pandemic, you would see an African American or a Hispanic or an Asian person in a senior role talking about how they were dealing with the pandemic. In Britain, all we have is SAGE, and only recently they only adopted and put a number of BME people on the SAGE committee because it was so embarrassing to have, literally loads of white men and telling us what they think they knew best without even engaging with us. And that's a big issue. And that's still a big issue even today, because if you read in today's Huffington Post, there is still a colourblind policy being adopted around a vaccine rollout. That's the bit that was never explored. That, it's only down to trusted voices, people here on this call who have gone the extra mile without support from the government, by the way, who have created their own messages. I mean, there'll be more video. I've seen loads of fantastic videos and messages done by BME health professionals without any support, any resources by the government, to be quite honest. We've just done it ourselves, like we always have to do, around self-care, our own agency. And I think this is really, really important, that we have to encourage people to do that. That's the first thing I want to say. In terms of the history, that history of the Tuskegee experiment does have an impact on, particularly on the Black community, because there is a powerful mythology, and it's just further reinforced in the last 30, 40 years, when you have pharmaceutical companies who've dumped cheap drugs and drugs which have been outlawed by the regulators here in Britain and in America, been dumped in Africa with atrocious side effects. So there is a genuine concern and reason why people might feel hesitancy, and these kind of theories about chips and stuff like that in there. But to dispel this and to create the trust and confidence, it's down to us, as community leaders, faith leaders, local politicians, and activists as well. So back in January, I had the opportunity to take the vaccine early. I sit on the board of Hertfordshire NHS Foundation Trust. It's a mental health trust which covers North London and Hertfordshire. And actually, that particular trust has got one of the highest rates in the country of BME staff taking the vaccine. And that's because it's a good trust. It's one of the outstanding trusts, mental health trusts in the country, and they have a good working relationship with the staff. And it was easy for the staff to take the vaccine because it was not only about protecting their lives, but also protecting the lives of the patients and service users that we look after and care for in that part of the country. But one of the reasons why there is a low uptake, particularly with Black staff, is the experience of structural racism. Let's face it, let's be real here, guys. The structural racism and institutionalized racism, where you're bullied, harassed, you've been held back in your career development for many years and decades, and then management turns around and tells you, take the vaccine. So the trust works both ways. It really does. And, so it's not simply about building a confidence and saying, oh, these BME health workers are hesitant. No, we don't trust management. They don't trust management because management has let them down when they had concerns about being bullied and harassed and experiences of discrimination. And so this is a lesson for the NHS to learn that if you respect your staff will respect you. This is quite important. And then in terms of the wider context of this issue around trust and confidence, as we have to look at the government. Over 120,000 plus people have died in Britain. We don't know the full extent of how many Black and Asian people have done, because I'm sure that we'll get the full proper details around deaths much better. I know the ONS have done stuff, but we haven't had the complete data that we really need. But I believe that probably 1 in 3, 1 in 4 people in Britain who've died of COVID are from our communities. That is, bearing in mind that we're only 13% of the population. There is something mentally flawed here. And when the government started in the early days, remember, started to use eugenic type theories, and luckily a number of female health professionals particularly shut this down straight away. Otherwise they would keep pushing this eugenics theory that, you know, Black and Asian people are more likely to get COVID because there's something about their DNA. You know what I mean? You know, look at Henrietta Slacks, African American woman who died in the 50s, who pharmaceutical companies used her, took the DNA out of her body without the permission of the family and made billions of dollars. And again, it wasn't until an investigative journalism that was exposed. So, you know, so this point is really important. The government have let down BME communities. There've been a number of organisations from trade union movements, GMB. I've been working closely with GMB. A number of politicians, mainly Labour politicians, have been demanding a public inquiry. You've got the COVID Family Network who are taking judicial review, which as well, because we need to have answers about the whole handling or mishandling of this situation and why we've been disproportionately affected by this. This is quite an important issue, and this is a quite important issue for you as activists and politicians. It's about accountability, it's about scrutiny, basically, and this is really important. And this feeds into the mistrust, not hesitancy, into the mistrust that we do. But it's important that we need to encourage people to take the vaccine. So I took the vaccine in January, nearly 2 months ago. I put on social media, you know, like we all are doing right now, images of with injection. I did a couple of videos, and over 50,000 people have seen my messages on all my platforms, and people have contacted me. And I know for a fact, very similar to Jeff, look, I know people have taken the vaccine because they see me as a trusted community voice for all the work I've done in the community for many decades. I didn't just arrive yesterday and say, let's talk about the vaccine. People rely on you, people on this call, you've done the legwork in the community, you delivered stuff in the community, people know who you are, so people are more likely to trust you as well as BME health professionals, because they want to see that you've got a track record of support and engagement, as opposed to, yeah, some of the celebrity videos do work, but it doesn't really work that way because people want trusted voices, basically. So this is quite important, and I do urge to get those to get the messages out there. But also we have to recognise that a lot of people are sceptical about this, and even now I still get messages from WhatsApp, texts for people who check in on me regularly. Patrick, are you okay? Yes, I'm okay. Patrick, are you really, really okay? Yes, I'm okay. No, I haven't got extra breast, I haven't got tail, I'm okay. And this is really important because this is the fears that people have. You have to allay people's fears, and then people will do that. And so going back to like with Grace's mother, he lives in Wandsworth. He's 81 years old from Trinidad, and his next door neighbour is a good friend of mine, who's a journalist. And he said to me, "Oh, Patrick, I've tried to convince him. He's not going to take the vaccine." So guess what he did? He showed him a video clip of me being interviewed on TV, and guess what? And then guess what? He decided, because he'd rejected about 3 times, and then he took the vaccine. I called him last week. I don't know him, but I was given his number. And I said to him, "Thank you very much for what you did." And he said, "You know what? Thank you for sharing that message, because I wouldn't have done it otherwise." It's these simple acts of engagement. No sophisticated social media messaging. Conversations with people, listen to people, check in with people. That's what we have to do. This is called community development, something which this government doesn't like using that word, but community development, community engagement, resident involvement, call it what you like, is really, really important. And we've got to mobilise more of us to talk to people, especially those people who don't have regular contact with individuals because of how they live and stuff like that, to take the vaccine. I'm quite conscious of the time. Just a final thing I just want to say, that it's really important now, we have to start thinking about, it's not just about taking the vaccine and reminding people. We now need to look at what does Ealing look like in a post-COVID world? What does it look like where I live in a post-COVID world? And one of the key things, you know, I worked in public health nearly 20 years ago. I was director of the Health Action Zones. That was a Labour project. 26 health action zones around the country with budgets. We did fantastic stuff in the community, but unfortunately politicians ran out of time with us because sadly it takes 20 years to improve life expectancy for individuals. It doesn't happen sadly in a council election term. So in terms of planning, make sure that you support your public health colleagues. If they said we want more resources and more funding, give them more money, give them more resources. Don't see this. This is really, really important. We need to now make sure that there's more public literacy around health and well-being. This is going to be core business of local authorities now, in partnership with the NHS. But this is now core business of local government to make sure that public health is protected, that we lobby for more resources. Because if you remember, there's been a cut of £1 billion in public health funding by this government over the last decade. We need to get that money back and to fund high quality, community-led services, support our BME professionals, and make sure that the NHS have proper representation at senior management level. And I hope that your scrutiny committees will be challenged the NHS to make sure that happens as well. I'll stop there.
So thank you, Patrick. That's very, very helpful, very informative and very powerful.
Okay, fine. So thanks for putting this on again, Grace. It's fantastic, and Sue as well, and you too, Hitesh. It's, I think, been a really good evening and powerful. I think it's probably helpful if I quickly just tell you where we are in the vaccination rollout in Ealing, and I'll also talk about some of the disproportionate stats as well in terms of take up of the vaccine too, so I'll give you those. But so far, as of today, I was told that we have given out 96,000 vaccines, and we're expecting by the weekend to have hit the 100,000 mark. So that's really positive. Current Ealing vaccination sites, we've got 2 primary care network sites at Ealing Town Hall and the Dominion Centre. Then we've got a mass vaccination centre at CP House on Uxbridge Road, West Ealing. And then we've got 6 currently pharmacies that are also linked into the national booking system, like the mass vaccination centre at CP House. So I'm quite excited. I'm going for my vaccine on Friday morning, and when I booked through the national booking system, it gave me the option of going to the pharmacies or the CP House mass vaccination centre. I'm told that GPs will also be able to give access to that national booking system and the mass vaccination centre as well very shortly. In terms of the current data, and I've got the kind of overall percentages that 96,000 total vaccinations is for each of the different cohorts. So we'd got those first 4 priority cohorts, which were the 80 plus, the 75 to 79, 70 to 74, and the clinically extremely vulnerable group. Of those groups, we've vaccinated just over 87%. And these were figures that I got as of the 7th of March. The top 80 plus cohort, 86% vaccinated. The 75 to 79s, we've got 93% vaccinated. The 70 to 74s, 96% vaccinated, which is pretty impressive, I have to say. Clinically extremely vulnerable, slightly lower, only 74% of being vaccinated so far in that group. We're now working on both the 55 and above categories. So 65 to 69, we've vaccinated 87%. 60 to 64, we've vaccinated 81%. And then we're just working on that 55 to 59. And so far we've done 48% of that group. And it won't be long before the 50 to 54 group is opened up as well. Just to give you the figures for the percentages and numbers who've received vaccines in care homes. So actual residents of care homes, it's 88% have received the vaccine. In terms of care home staff, 60% have received the vaccine, and domiciliary care workers 43%. So those figures have gone up, but there's still a lot of work to do. And all of these figures I'm giving you are the first vaccine. We have actually started to roll out the second vaccine now. So the people who got the first doses in December, they're now starting to get the second dose. Those will be provided through those two community network sites at Dominion and Ealing Town Hall. In terms of the kind of strategy of how this is working, the NHS have done some research in terms of people's readiness to take the vaccine. So and this is from the 70+ age-based cohorts that have already pretty much had the vaccine. So out of those over 70, 60% of them had kind of got high readiness. You didn't really need to do anything to get them to do it. They proactively you offer them the vaccine, off they go. They get it. Then there's medium readiness, about another 20%, which takes you up to 80% altogether. And then that last 20% is low readiness. Now, the mass vaccination centre at CP House is best suited for those with high readiness. The pharmacies are best suited for those with medium readiness. So they're prepared to be vaccinated, but they're a bit nervous and they prefer a familiar local setting. And then those who have got that low readiness to be vaccinated, the best place to reach those people are through community leaders, as we've been hearing about, and fantastic stories from Grace's mom and also from Patrick, and how people have taken up the vaccine, having listened to that reassurance that they've been given. So it's about relationships with community leaders and with GPs. And so what we're looking to do is use actually GP surgeries for some kind of day clinics where people can get the vaccine in whatever age category we're working on, the 55 pluses at the moment, in order to so that where they're feeling hesitancy and worry, that they can go to someone they trust, their GP, their surgery, it's the setting they know, or they can go to a faith setting is the other thing. So I'm actually going to visit Acton Mosque on Oldham Terrace tomorrow to look at how we can set up a community pop-up vaccine, temporary vaccine day in a faith setting where people feel comfortable. In terms, let me just give you the national picture, and this was in terms of, and I know Patrick's gone now, but I would try and not use.
He's still here, actually.
Yeah.
He's still on the just
to go, I
not,
can go.
it's fine. Just avoid too much stats, actually, because people are trying to absorb it.
So sorry. So I'm only using hesitancy, Patrick, because it's what's being referred to in this study, and this was a study that came out last December, and it was from a random sample of 12,000 people undertaken in December 2020, and it showed that, and these were figures I remember seeing them in the Guardian. Black British people were 72% showed vaccine hesitancy. Pakistani, Bangladeshi 42%, mixed 32%, white other 26%, Asian or Asian British 21%, and white British 16%. Now, let me just give you the Ealing figures, and these are these will probably be my last stats, Hitesh, okay? But probably these are the most important ones, because this is Ealing figures from the 10th of February.
Right, everybody, so there's a test at the end of this, okay?
So a little bit out of date. They're a month old, effectively, these figures, and this is ethnicity percentage uptake for various ethnicities. Okay, so it's 72%. It's 71.97 actually. I think we can round that up to 72% for Asian or Asian British, and then the lowest percentage uptake is Black or Black British, and that's 48.35%. And then mixed is 55.96, and then other ethnic groups, it says 66.95, and then white is 79.44. So, you know, the highest grouping is white, and that's 79.44, and the lowest is Black or Black British, 48.35. So, you know, a significant gap that needs to be tackled, and I'm grateful for Grace and all of you for tackling that, and we need to do a lot more, obviously. In terms of where we put these pop-up sites, we've got a huge list now of faith settings right across the borough that have volunteered to do these pop-up sites for vaccinations, and we've got them split up into the different wards in the borough. We won't be able to take up all the offers that we've been given, but we will be looking at where the need is greatest, and certainly Acton and Southall and Northolt are the areas of greatest need in terms of all you know, high BAME populations, high levels of deprivation in those parts of the borough, and also at the moment that's where we need more sites as well. So to tackle that, we've also got so just to give Acton as an example, we've now got 14 Acton GP practices that are ready to do short one-day clinics.
Okay, Julian, I'm going to have to ask you to wind up a bit, if you don't mind.
Yeah. Well, I'm pretty much finished. I just want to say one final thing about pharmacy sites. So again, we at the moment we've got those 6 pharmacy sites are in the centre of the borough, but we need some pharmacies in Acton and Southall and Northolt, and we've got again a whole plethora of applications from pharmacies in those parts of the borough, which are currently being looked at, and it's not by the CCG, it's NHS England that do that assurance work to approve these pharmacy sites, but we hope to get those in play certainly by the end of this month, so that we can get a really good vaccine coverage, particularly in those areas of high BAME communities and high deprivation in the borough, and low take-up of the vaccine.
Okay.
Thanks, Hitesh.
No, thank you. That's very informative. It's helpful, and obviously that's what information we need.
I'm out Monday. I'm one of the nurse practitioners actually working in Ealing. Also working at the vaccination site. I've been volunteering over weekends. Yes, pro-vaccination. I do think listening to the council member Julian Bell, certainly I think one of the things that could contribute towards us, getting our populations up is bringing, the vaccinations actually to the GP surgeries, because at the moment we can only really take up, go to the town hall, collect the vaccinations and bring it to our clients though, and that would certainly help to get the numbers up, because many of my patients ask, why aren't you having the vaccines here? We trust you. So it is really, it's a thing that I think should have been taught, brought right from the start though. So I'm here to answer any questions. I don't exactly know what else you want us to say. We're here to help those ones who may need their minds made up, give you more information. So yeah, Mami, I don't know what you want to say.
Yeah, I agree as well that I think definitely bringing the vaccinations to the GP setting should have been one of the first things that we did right from the beginning. We are hopefully having a small pop-up session next week, Thursday afternoon, with one vial of, I think it's AstraZeneca. And we'll see how that goes, just to try and get as many people in as possible. But I think definitely, because one, Ealing is quite central, but at the same time, to a lot of people say, oh, we don't have parking, or it's difficult for me to get there. Whereas with a GP, the GPs are literally at their doorstep, and they find it much easier to get to their GP surgery, especially for those who are coming from. I live in Greenford, and the closest one is Dominion. But then for those who are in Northolt, who still fall under Ealing, there's nothing really as close to them. I mean, we can say that Southall is closer, but then you still have the problem of lots of traffic and all the roadworks going on. It's going to put a lot of people off, because to them they said it's just too far. Because I do have one patient coming on Thursday who said, I'm just not going to go because it's just too far for me. So if you're doing it in the practice, I'd rather come to the practice. So whatever can be done to help bring as many vaccinations to the GP settings, I think will make a huge difference in reaching a lot of people. Yes.
Thank you. I think there's a couple of Greenford councillors on here. I'm sure they'll push the message for something local, although they'll continue on that front. I've got Abdi.
Yes.
Are you ready? Thank you for coming again tonight. Well,
No, not at all.
Thank you, Mami, and Elmi. Thank you.
And thanks so much for having me. And I'd just like to, echo the two messages that we just had. I think I come from a comms, so I work in comms, and I guess that's why I've been invited to talk about that kind of aspect. I think the one thing the government got wrong is although the vaccine rollout's been going well, is who the message should come from. We've had 10 months of things going wrong, and I think that message about the vaccine should have come from GPs, people that are trusted more locally, and people that that are more accessible to vulnerable residents. To a quick anecdote, 2 weeks ago I was speaking to my mum. Unfortunately, she had an accident. She had to go to hospital. She was really afraid about going to hospital because of everything she's heard about the virus. And I said to her, have you not got an invitation to be vaccinated? She's fairly vulnerable. And she said, yeah, she turned it down. And I asked why she turned it down. And apparently, she said, her sister told her all sorts about it, and they saw a WhatsApp message. And that's when I thought, oh God, there needs to be much more that needs to be done for people of the Somali community, but people of ethnic minorities as well, to get that messaging out. So I've been working with Virendra Sharma's office to get video out in Somali that is targeted toward the Somali community, and to get into those WhatsApp groups for people to kind of what was it, pass on and for that message to get out. But I think I saw the question about the vaccination stuff. Like we have to be unequivocal in our support for this vaccination. We could talk about natural healings and stuff like that, but I don't think that's the time right now, when people are losing their lives, and our key workers are day in, day out trying to save lives in hospitals. And I think it's really important for us to put our weight behind this vaccination, which has been proven by the scientists to be efficient, even against the kind of variants that are popping up here and there. And I think it's very important for that messaging for us to be concise and not turn around and kind of gamble on that, because we are gambling on people's lives if we are calling, if we are questioning the efficiency of these vaccinations. And I think that's important. The council, I think Ealing Council has done absolutely brilliantly to reach out to the communities. If it's we're 1 year away from now from the beginning of the lockdown, and the council did take really good steps to reach out to the residents, vulnerable residents, to kind of support them and make sure that they have that support. And I know that support is continuing. So kudos to Julian and all the councillors on this chat who've set up mutual aid groups and WhatsApp groups for residents. I know I've got cousins, I've got aunties who've been people that have received some of the packages that the council's put out. So well done to you guys, and well done for all you're doing. And yeah, keep going. That's my only message really from tonight.
No, thank you, Abdi. No, I appreciate that.